Hello, I'm Deirdre from ChronicUTI Australia. Like our counterparts in the United Kingdom, ChronicUTI Australia advocates for better testing, diagnosis and treatment of UTI and awareness that problems in these areas are leading to chronic embedded bladder infections. I'd like to tell you about our Hearing Patient Voices survey, which was an online survey of people with chronic UTI that we completed last year. The survey was quite detailed, and I'll just be giving you an overview tonight. If you'd like to know more, the full report and various summaries are available on our website at the address shown here. We dedicated the survey report to Professor Malone-Lee. There is no official recognition of chronic UTI in Australia and no specialist treatment clinics here, so many Australian patients have sought care from the professor. He continues to be regarded with great admiration and remembered for his warmth and deep care for his patients. So, first a little bit about the people who completed our survey. We had 410 adult participants aged 19 to 84 years, and overwhelmingly our participants were women. We enlisted the help of overseas support groups to distribute the survey, and as a result, we attracted participants from the UK and the United States as well as Australia. There are also small numbers of participants from a range of other countries. 4 in 5 of our participants had been diagnosed with a chronic UTI by a health professional, and the others suspected they had a chronic UTI but were yet to receive a formal diagnosis. We had a relatively experienced patient group. 9 in 10 had suffered chronic UTI symptoms for more than a year, and some had suffered for several decades. I'm going to present the survey findings in terms of 4 key themes that emerged from the data. These are the severe quality of life impacts of chronic UTI, people's experiences and perception of diagnostic and treatment failures, other experiences of being treated poorly by health professionals, and the high usage of health services in this patient group, which results in avoidable costs to the health system as well as to patients themselves. First, let's talk about pain. This is an almost universal feature of chronic UTI. Along with urinary frequency, which was experienced by more than 90% of participants, pain was the major cause of the quality of life impacts I'll discuss shortly. We asked survey participants to use a 10-point pain scale to rate the severity of their chronic UTI pain at its worst. As you can see from the table to the right of the slide, self-reported pain levels were very high. Nearly half the respondents rated their pain as excruciating, unbearable, 9 on a 10-point pain scale, or unimaginable, unspeakable, 10 on a 10-point scale. The average rating was 7.9 out of 10, indicating pain in the upper range between very intense and utterly horrible. About 94% of participants said their overall quality of life had been impacted, at least moderately, by their chronic UTI symptoms, and nearly half described the impact as extreme. Although there were big impacts in all life domains, including work and study, the heaviest burdens were felt in domains that had to do with relationships, emotional well-being, and sexual intimacy. These self-rated impacts were reflected in participant scores on the SF-12, which is an established quality of life measure that we included in our survey. As a group, our participants had much worse mental and emotional health than the general population, matched according to age and gender. In all, 70% were below population norms, with 50% scoring well below the norm. Turning to the next slide, this graphic categorises participants' answers to an open-ended question asking them to describe in their own words the impact of chronic UTI. Most worryingly, nearly 10% disclosed, without any prompting, feelings of wanting to or even trying to end their own lives. Many participants wrote detailed answers to this open-ended question. When analysing and coding the information, I found it harrowing to read countless accounts of lives derailed by chronic UTI. In the worst cases, people had lost their livelihoods and relationships. Some were housebound, even bedbound, and some had endured this suffering for many, many years. The quotes shown on this slide are just a few examples of what participants wrote. I'll give you a moment to read them. This next slide shows findings from the questions we asked about people's experiences of getting diagnosed and treated for chronic UTI. More than 80% of participants agreed or strongly agreed that it had been difficult to find a health practitioner who understands and can treat chronic UTI. A staggering 93% had returned a negative urine culture test while experiencing UTI symptoms, which highlights the insensitivity of standard UTI tests, especially for embedded infections. Experiences of misdiagnosis, most commonly with interstitial cystitis or painful bladder syndromes, were very common. Consequently, more than 2/3 of participants had been offered or given inappropriate therapies, including surgical procedures in many cases. About the same number had been told that nothing could be done for their symptoms. When we asked participants to describe in their own words their experiences of being diagnosed and treated for chronic UTI, one of the themes that emerged was the difficulty of accessing long-term treatment with full-strength antibiotics. Now, I hesitated before presenting the table on this slide because I'm fully aware that survey data are not suitable for assessing treatment effectiveness. It's interesting, though, that people being treated with ongoing full-strength antibiotics were far more likely to report that their chronic UTI symptoms were improving compared to people on continuous low-dose antibiotics, and especially compared with those receiving just short-term antibiotic treatments. Also interesting is the fact that there was an average of 8.5 years between participants' first acute UTI and the onset of chronic UTI symptoms, usually with an intervening period of recurrent infections. This suggests to me that there's often a substantial window for proper UTI treatment and prevention of chronic embedded infections. Apart from poor diagnostics and medical management, the survey found evidence of other poor healthcare experiences. The large majority of participants had found it difficult to find a health professional who understands and can treat chronic UTI. And it seems that victim blaming and medical gaslighting are alive and well. More than 80% of participants believed their symptoms had been dismissed or not believed by a health professional, and more than 75% had been given unhelpful advice to change their behaviour. 40% had had their chronic UTI symptoms attributed to stress or poor mental health. I'll give you another minute to read some of participants' own words about their experiences. In this case, taken from their responses to an open-ended question asking them to describe their experiences with healthcare professionals when seeking help for chronic UTI symptoms. Next, we asked participants how often they had used various types of health services in the last 12 months and compared the result with data from the general Australian population. For both Australian and international participants, rates of health service utilisation were much higher than Australian averages. The differences were most pronounced for resource-intensive services, such as medical specialists, hospitalisations, and emergency department visits. Participants were almost 3 times more likely to be admitted to hospital or to have seen 3 or more health professionals in the previous 12 months. So, to recap on our main findings, first, people with chronic UTI typically suffer severe pain and quality of life impacts. This can and does go on for years or even decades. Second, many participants believed, probably rightly, that diagnostic failures and failure to effectively treat their earlier acute and recurrent UTI had led to the development of chronic embedded infection. Misdiagnosis and lack of understanding of chronic UTI also means that people are subjected to a range of ineffective and potentially harmful medical and surgical treatments. Third, experiences of feeling dismissed, belittled, and disbelieved by medical professionals are very common in this patient group. And fourth, chronic UTI results in unnecessary costs to the health system. To finish up, I'd like to acknowledge some of the people who made the survey possible. First, I want to thank the survey participants. As I mentioned, many wrote detailed accounts of their personal experiences, which gave us a rich source of data to work with. Andrea Sherwin and Imelda Wild of Chronic UTI Australia helped with the survey design and the interpretation of results, informed by their deep understanding of chronic UTI. And many others from the patient community assisted with pilot testing the survey and distributing it via their contacts and online support groups. I'd also like to thank our financial sponsors, Community Underwriting, Feel Better Box, and Jude. Well, the survey gave us data about what our patient community faces that we haven't had before. We're already using it in our advocacy work in Australia, and there are some small signs that our messages are starting to be heard. We'd be very happy to share the survey data with researchers or other patient advocacy groups. If you'd like more information, please get in touch with me at the email address shown. Thank you very much for listening. Good night.